Welcome to today's video lecture on madeformedical.com. Today, we're going to delve into a fascinating topic, amyloidosis. Before we start, don't forget to check out our website, madeformedical.com, for hundreds of more videos like this at the end of this video. Link is in the description. Amyloidosis is a rare and complex group of diseases characterized by the abnormal buildup of amyloid proteins in various organs and tissues throughout the body. This condition often goes undiagnosed or misdiagnosed due to its diverse manifestations and symptoms. With advances in medical research, our understanding of amyloidosis has grown, leading to improved diagnostic techniques and potential treatment options. In this video, we will delve into the intricacies of amyloidosis, its types, pathogenesis symptoms, diagnostic approaches, and the ongoing efforts to develop effective therapies. Amyloid refers to an abnormal proteinaceous substance that can accumulate in various organs and tissues. It is produced when normally soluble proteins misfold and aggregate into insoluble fibrils, which deposit in different parts of the body. The accumulation of amyloid disrupts the normal structure and function of organs, leading to a range of clinical symptoms. Under normal circumstances, proteins in the body are folded into their proper three-dimensional structures, allowing them to perform their functions effectively. However, in amyloidosis, these proteins become misfolded or undergo a conformational change, resulting in the formation of abnormal beta sheet structures. The misfolded proteins then aggregate and form amyloid fibrils, which have a characteristic beta-pleated sheet configuration. These fibrils are insoluble and can accumulate in various tissues and organs, disrupting their normal structure and function. Amyloidosis is a complex disease characterized by the accumulation and deposition of abnormal protein structures called amyloid fibrils in various tissues and organs. The pathogenesis of amyloidosis involves a series of events that lead to the misfolding, aggregation, and deposition of proteins as insoluble fibrils. While the exact mechanisms underlying amyloidosis development are still not fully understood, several key factors contribute to its pathogenesis. Protein misfolding. The pathogenesis of amyloidosis begins with the misfolding of specific proteins. Normally, proteins fold into their functional three-dimensional structures like this diagram, allowing them to perform their biological roles effectively. However, in amyloidosis, certain proteins undergo a conformational change, resulting in their misfolding and adoption of a beta sheet-rich structure that looks like this. This misfolding makes the proteins prone to aggregation and fibril formation. Aggregation and oligomerization. Misfolded proteins have a propensity to aggregate and form oligomers, which are small clusters of protein molecules. Oligomers serve as intermediates in the formation of amyloid fibrils. The precise triggers for protein aggregation and oligomerization in different types of amyloidosis are still under investigation, but factors such as genetic mutations, oxidative stress, impaired protein clearance, and alterations in protein homeostases have been implicated. Fibril formation. Fibril formation, oligomers further assemble into elongated fibrils with a characteristic beta sheet structure. These fibrils are stable, insoluble, and resistant to degradation. The fibrils can vary in size and morphology depending on the specific protein involved and the type of amyloidosis. The accumulation and deposition of these fibrils disrupt the normal architecture and function of affected tissues and organs. Extracellular deposition. Once formed, amyloid fibrils are deposited extracellularly within tissues. The mechanisms by which fibrils are transported and deposited are not completely understood, but they may involve interactions with cellular components, extracellular matrix molecules, and specific receptors. The deposition of amyloid fibrils can lead to tissue damage, inflammation, and organ dysfunction. The presence of amyloid fibrils triggers a cascade of secondary events and cellular responses. The fibrils can induce inflammation, activate immune cells, and cause oxidative stress, further exacerbating tissue damage. Inflammatory mediators and cytokines released in response to amyloid deposition contribute to the progression of amyloidosis. Amyloidosis is a complex disease with a wide range of clinical presentations that can vary depending on the organs and systems affected. The clinical manifestations of amyloidosis are diverse and can involve multiple organ systems. Recognizing and understanding these presentations is crucial for timely diagnosis and appropriate management. Here are some common clinical features associated with amyloidosis. Systemic symptoms. Many individuals with amyloidosis may experience systemic symptoms, such as fatigue, malaise, and generalized weakness. They may also experience burning, itching, and increased eye fatigue. Organ-specific symptoms. The clinical presentation of amyloidosis depends on the organs affected by amyloid deposition. Here are some specific manifestations based on organ involvement. Cardiac involvement. Patient can have heart failure symptoms such as fatigue, shortness of breath, exercise intolerance, leg swelling. Or they may have symptoms of arrhythmias such as palpitations, dizziness, syncope. Restrictive cardiomyopathy is also an important feature of amyloidosis, such as reduced cardiac function, diastolic dysfunction. Renal involvement. Patient may present with features of proteinuria, for example, excessive protein loss in the urine, leading to frothy urine or edema. Or they can have features of nephrotic syndrome like edema, hypoalbuminemia, hyperlipidemia. They can also have renal impairment like decreased kidney function, elevated creatinine levels. Neurological involvement. Peripheral neuropathy, such as sensory, motor, or autonomic neuropathy, leading to numbness, tingling, weakness, or dysautonomia. Gastrointestinal involvement. Gastrointestinal bleeding, blood in the stool melena. Diarrhea or constipation, altered bowel habits, abdominal discomfort. Malabsorption, nutritional deficiencies, weight loss. Hepatic involvement. Hepatomegaly, enlargement of the liver. Elevated liver enzymes, abnormal liver function tests. Impaired liver function, jaundice, coagulation abnormalities. Skin manifestations. Purpura, bruising or purple-colored spots on the skin. Petechiae, tiny red or purple spots caused by bleeding under the skin. Ecchymosis, larger areas of bruising. Cutaneous nodules, firm, raised skin lesions. Musculoskeletal symptoms. Joint pain, arthralgia, stiffness, swelling. Carpal tunnel syndrome, numbness, tingling, weakness in the hands. Diagnosing amyloidosis involves a systematic approach that combines various diagnostic methods. Here are the key steps involved in diagnosing amyloidosis. Clinical history and physical examination. Gather a detailed clinical history, paying attention to the patient's symptoms, duration, and progression. Look for red flags and signs that may suggest amyloidosis, such as unexplained organ dysfunction, systemic symptoms, or specific clinical features associated with the disease. Conduct a comprehensive physical examination to assess for organ-specific findings, such as cardiomyopathy, nephrotic syndrome, peripheral neuropathy, or hepatomegaly. Laboratory investigations. Order a series of laboratory tests to aid in the diagnosis of amyloidosis. These tests may include serum and urine protein electrophoresis. Helps detect abnormal protein patterns. In amyloidosis, an abnormal band may be present, indicating the presence of a monoclonal protein. Immunofixation electrophoresis identifies the specific type of abnormal protein present in the serum or urine, differentiating between types of amyloidosis. And other tests, such as complete blood count or CBC, LFTs and RFTs. Imaging studies. Order specific imaging studies to evaluate organ involvement and identify amyloid deposits. These may include echocardiogram. Assesses cardiac function, identifies any signs of cardiomyopathy, and evaluates the presence of amyloid deposits in the heart. Chest X-ray or CT scan. Helps identify pulmonary involvement and assess the condition of the lungs. Abdominal ultrasound or CT scan. Examines the liver, kidneys, and other abdominal organs for signs of amyloid deposition. Biopsy and histopathological analysis. A definitive diagnosis of amyloidosis often requires a biopsy of an affected organ. The choice of the biopsy site depends on the suspected organ involvement. Common biopsy sites include the abdominal fat pad, kidney, liver, bone marrow, or affected organ itself. The biopsy sample is examined histologically using special stains such as Congo red and immunohistochemistry to confirm the presence of amyloid deposits and determine the specific type of amyloidosis. The treatment of amyloidosis involves a multimodal approach aimed at reducing amyloid deposition, managing organ dysfunction, and improving overall patient outcomes. The specific treatment plan depends on the type of amyloidosis, the extent of organ involvement, and the patient's overall health. Targeting the underlying cause. In primary amyloidosis, where amyloid deposits are composed of abnormal immunoglobulin light chains, the treatment focuses on suppressing the underlying plasma cell dyscrasia. This typically involves chemotherapy or targeted therapy regimens aimed at reducing the production of abnormal plasma cells and light chains. In hereditary forms of amyloidosis, such as hereditary ATTR amyloidosis, treatments may include medications that stabilize or reduce the production of the abnormal protein associated with the disease, such as transthyretin TTR stabilizers or TTR gene silencing therapies. Symptomatic management. Managing organ dysfunction and providing symptomatic relief are essential components of amyloidosis treatment. This may involve various supportive measures, such as cardiac management, medications to control heart failure symptoms, arrhythmias, and blood pressure. In some cases, heart transplantation may be considered. Renal support. Monitoring kidney function and providing interventions to manage proteinuria, maintain fluid and electrolyte balance, and prevent further renal damage. Neurological support. Symptomatic treatment for peripheral neuropathy, autonomic dysfunction, and other neurological manifestations. Gastrointestinal management. Addressing gastrointestinal symptoms, optimizing nutrition, and managing complications such as malabsorption or gastrointestinal bleeding. Organ-specific interventions. In some cases, organ-specific interventions may be required to manage complications associated with amyloid deposition. For example, liver transplantation. In hereditary ATTR amyloidosis with significant liver involvement, liver transplantation may be considered to remove the source of the abnormal protein production. Kidney transplantation. In selected cases of amyloidosis-associated kidney disease, kidney transplantation may be an option for patients with preserved cardiac function and limited extraurenal involvement. Ongoing monitoring and surveillance. Regular follow-up and monitoring are crucial in amyloidosis treatment. This involves assessing organ function, monitoring disease progression, and adjusting treatment strategies as needed. Close collaboration with specialists in cardiology, nephrology, neurology, and other relevant disciplines is essential to provide comprehensive care. Amyloidosis is a complex and often underdiagnosed group of diseases characterized by the abnormal buildup of amyloid proteins. Improved understanding of amyloidosis has led to better diagnostic techniques and treatment options, offering hope to patients affected by this rare condition. Ongoing research and clinical trials hold the promise of more effective therapies and better management strategies for amyloidosis in the future, potentially improving patient outcomes and quality of life. And that brings us to the end of our today's video. I hope you found the information helpful and informative. If you enjoyed this video, don't forget to give it a thumbs up, and don't forget to sign up for a premium membership on our website, madeformedical.com, for more content like this.